Well, hello everybody. It is buyout day and we have horses on the way. They're about to get brought up here. They're going to get unloaded, seen by our veterinarians. It's going to be an amazingly busy day. We have either 20 or 35 coming in. We rescued 21 the other day through the buyout program. So we're getting a lot of horses again this month. And can't wait to show you the horses. Our team has already come up and got prepped. We're just waiting for the trailer to come up. So here we go. Interestingly enough, it's not particularly hot today. It's actually kind of rainy and cool, temperate, I guess would be the right word. So we're looking forward to not sweating to death and having to order popsicles and all that stuff. But I wonder if anyone ordered us pizza. Probably not today. Oh well, maybe next time. Everyone's just getting set up and ready to go. I already have a horse in there from, where's that horse from? The previous buyout?
Yes, he's one of the castrations that we did.
Okay. So yeah, so this horse was recently castrated and cute little guy. Load of precious lives in there. Alrighty, horse number one. It's like, ooh, some green grass. Number two. Three. And here they come. Four. Five. Number six. Number seven. Number eight. Number nine.
That one's also left front leg. Holy moly.
Number 10's just standing on the trailer.
Oh my goodness, this is the really bad carcass.
Number 10. Oh, that front leg. Oh. 11. Number 12 is stepping off.
Yep.
Lost track there. I think we're at 13 maybe. My bad.
On the reservation, just only like the thing.
Yeah, that's pretty significant left hind. Or pelvic.
She's got a big old scar on the left hind here.
Yeah.
Back here.
Okay, this horse needs to be a priority.
Yep. You got any studs on here?
This is the worst one.
That's the worst one. What's wrong?
What's up in the ass is blind. I wouldn't put him in there.
Caleb, can you grab a lead rope, please? Yeah.
There they are.
You don't got no studs or anything on there? Well, sometimes, you know, we get trailers here and they say, nope, there's no studs, and then they're all studs.
So what do you think, Mari?
A lot of horses, a lot of drafts.
Yeah.
You want to come around in here and grab this horse for me?
Yeah.
Just be careful, it is blind, so give it plenty of space when stepping off the trailer.
So this one is blind.
Well,
And it's got a freeze brand.
Yeah.
03133 it looks like to me.
to me this day. Seems really sweet. Yeah.
Getting them a little hay to start their day off with here at the shelter. Dr. Lydia's already selected the first one she wants to evaluate, which is the one with the really bad front leg.
Next time through here, can we have 2 10cc syringes with Banamine?
Oh, so terrible. Unbelievable. Look at that poor knee. Oh, so bad. So bad. And this is a draft horse, and it's so much weight on that leg, and it's broken, and oh, it's just so bad.
Caitlin, and then as soon as we have pain meds on board, I would love radiograph.
And then this horse has got all kinds of problems up here, and just so miserable. Poor horse. What a sweet face. Up to weight. Seemed like more of these horses were up to weight than usual, and but when you're dealing with broken legs, being up to weight isn't necessarily a great thing.
We pulled these 2 geldings out. They both seem to be very painful. I haven't gotten accurate heart rates yet. I'd like to give it just a quick second once they get off the trailer, so that's not a false elevation. This horse is non-weight bearing lame on this left front. He's got a deep puncture wound on the front of his leg and also on the side, and it's very hot and swollen. And I'm gonna stop right now and just get them pain meds, and I'll keep talking about it in a second. This horse's leg is horrific, clearly was broken a long time ago.
So Dr. Lydia's giving pain medication to this horse. It's non-weight bearing front left leg.
Calming down a little bit, sir.
And she's going to be, Dr. Lydia's going to be giving pain meds to this horse.
See the muscle fasciculations? He's so fatigued from having to overuse this leg. He's leaning up against the gate over there.
How old do you think this injury is?
This one? Probably years old.
So this is the rest of the horses. There's definitely some medical concerns in this group, like that draft over there. But they're definitely treating the most urgent ones first.
We had 16 come off the trailer. As they were coming off, I did see several horses that were in critical condition that definitely need to be looked at first. I think we got a little bit of time before the next trailer gets here, so we're going to work through all these guys, probably break for lunch, and then come back and hit the ground running.
This horse is also a priority, and Dr. Lydia's getting right on her. It is a mare, and
Their vein off. Often that means they've had a lot of IV stuff and they're going to be reactive to the COVID. So I'm going to take this off. And we're going to do this trick. See, he kind of like knows what's coming. Okay, heart rate was in the 60s and it's come down to about 48, which is a really nice.
so heart rate was in the 60s when
Now
he
it's
first
48.
got here.
So 48 is still elevated. We still have pain. And a ton of effusion back here, but that's a really nice response. That's what we're looking for. This horse didn't just get Banamine, he also got Dormosidane. I would really like radiographs of this leg, but I don't think that we're gonna be able to fix it. So I wanna make sure it's fair to him, that he's comfortable enough that we can take an x-ray. And I think he is. I think we got ourselves a little bit of time. I'm just gonna palpate. It's hard.
How old do you think he is? 12?
He's 12. I think that injury is, it's definitely over a year old.
Yeah.
And I say that because, can you see the severity of the muscle wasting right here? Like this is one of the pectoral muscles. This one is also very weak, but look right here. I mean, there's not even a muscle there. And then it takes a lot of time. Wolff's Law, bones remodel in response to the forces put on them. So this is all bony right here. We're gonna radiograph it, but that much of a bony callus formation takes a ton of time. It looks like Dr. Gina is ready.
And then an age on this one.
Let me look at teeth. If you guys are ready, I think we can carefully move him out there. Just be aware, I don't want him to fall on that side. He's leaning pretty heavily on them. Hi. You are very sweet. Maybe 12 or 13. Let me look at this other side.
This poor guy, he just doesn't not
Yes.
want to move.
Gelding.
Oh, that leg. What do you think, Troy? You've seen anything like that?
Not to that severity now.
That's just so bad.
You can see where his hoof's been rounded off where he's been dragging it for so long.
Can you go on that one's B sheet and fill out what you were
Yes.
just saying because I wasn't over there?
Did you touch this?
No. This way.
Yeah. Have we come down here yet?
No, we were starting from the top and going down.
Okay.
By elbow. Try and get you this.
The first 16 horses are here, and there's some really, really rough cases. There's a completely blind horse. There's a horse with an old broken leg, a draft horse with an old broken leg. There's another horse with all kinds of problems with the leg. It's really sad to see these horses, but boy, I am so glad that they didn't go to slaughter. And just want to thank you guys so much for your support that enables us to save horses like these, and these specifically. Your donation, if you donated last month or so, your donation is going specifically to help rescue, shelter, and protect these horses. So thank you so much. You, my furry friend, are a little muddy. Just a little bit. Where'd you find all that mud?
Probably at the other place that we got.
But at least you got some good hay, and you've definitely got some problems going on down under, and yeah, I feel sorry for you, man.
I believe 1,400.
All right, we've got a big horse coming on the scale. Everything's a little moist this morning because it's been raining, thankfully. We were in the middle of a severe drought, and now we're not in the middle of a severe drought. And, let's see, Corey guessed 1,400. We're at 1,400 and 1,400. Sweet.
I'm pretty good at this.
Good job, Corey. I was guessing 1,405, but I forgot to say it out loud. Hindsight.
I'm sure you were.
Getting his little bucket of grain. Dr. Lydia's getting the heart rate for this horse. Dr. Gina's off with the x-ray to get more x-rays.
This draft horse, his leg is, the fact that he's been that way for so long and the fact that horses like him and his condition can ship to slaughter is just hard to wrap your mind around, and that's why we desperately need the SAFE Act to happen to protect horses like this. And then it's really heartbreaking to know that there's horses in the United States that are just languishing and suffering, and that legally they can be shipped to slaughter. And
happens, life gets a mess. From boots to whites ain't nothing but the best. When the pasture's high and the rain's rolling in, we smile through the mud 'cause we know where we've been.
See anything?
Looks like there's some around
She
the
was a standard bred.
P2. Have to go lower.
Perfect, okay. Okay.
That's more low.
Yeah.
There's
Yep.
nothing really up here. That's soft tissue. I don't see any gas tracks. There's a little something along this
Yeah.
where.
There's our chunks of bone, and there's more down here too.
Yeah. So I just have to trying
Well,
to
is that like an abscess right there, Dr. Lydia?
Unfortunately, what I think this horse has going on is osteomyelitis, which is a bone infection.
Just warning, we're looking under the side of a horse. Oh, oh, the poor guy. So messed up.
Yep, I agree.
So what's going on with this poor guy?
This horse is about 12 years old. He's got a severely swollen sheath. We don't know more than that right now, but I would say it's probably 7 to 8 times larger in diameter than it should be. It does look like he's got a possible recent castration scar. It could be an old scar that got stretched out, but castrating a 12-year-old has a lot of extra risks. So I'm gonna sedate him and hopefully palpate that area and see if we can figure out what's going on. I do think it might be safer to do that in the chute if we're able to get him in there. I can try it out here, but from the chute, if he kicks, he's just gonna kick fence.
I got you.
What is his breed?
I called him a 4-horse.
Ah. Come on, bud. Well, easy there. You're getting real good at that game.
Oh, yeah. When you do like 70 in 1 month, no, it was way more than 70. You get pretty good at it.
Yeah. A lot of Coggins.
Okay.
It's a little black horse. Corey's checking to see if he's gelding.
I think I feel scars.
Is he young?
Yeah, he's like 2.5.
Oh, nice. Young little youngster here. He's like,
Actually, I think I do. I might feel testicles.
He's like, anytime you want to stop messing with me, you're welcome to.
Yeah, he's got testicles.
Ah, he's a little stallion.
Guys are always lying to me. Every time we get a trailer here, I ask, do you have any studs on the trailer? And they say, nope.
That's because they're not willing to do what you just did to find out.
Every single time, we find at least one stud.
Yeah.
This guy, he's like, nope, we don't got any. I bet that's never happened before. I'm like, usually people tell me, and then I find one.
Well, next time you can tell them. So, Corey, you had a question, and Tom said to talk to you about it.
So I do have a question, and it's about food or pizza during intake. When I first got here for like the first 2 years, we always had pizza delivered on intake while we were up here working. We got to take a quick break, eat a couple slices of pizza, and get right back to work. It was extremely helpful, and it helped us stay efficient in our jobs. So if we could try to get that done again, I would really appreciate it. I mean, if you guys want to do pizza on the day of intake and the day after, I'm not going to complain, because that means I don't have to bring lunch for 2 days out of the month. But yeah, if y'all can make that happen for us, we would greatly appreciate it.
So, how we make that happen is you call our office
888-474-7077.
and you let them know that you would like to contribute towards our staff appreciation fund, which means that we are able to provide pizza or popsicles or, you know, if it's cold, hot drinks to our team while we're out here on the front lines of helping horses.
So we're not going to use money people donated for the horses to feed people?
No.
So people can donate money
people
to feed
can
people.
donate specifically to, you know, lunch for our staff. So employee appreciation, it just lets our staff know that we are appreciated from the donor side of it. So if there's money in the budget, we're able to buy pizzas and we're able to have, you know, stuff. And it really helps us when we are dealing with such horrible things, that to know that somebody cared to provide lunch for us. It's very, very sweet. So that it's always appreciated.
It's like scientifically proven that pizza boosts efficiency by like 100%. So if we have pizza, more energy, more efficiency.
This is a study of Emily.
On the left.
Is that the one that has, yeah.
We're looking through the
there's a
horses
different
that are
one that has
left
a
to
really
see
horrible-looking
if
eye.
anything's got a medical emergency and who they want to look at next. Horses, when they come in, they love their mineral blocks. Look at this, just munch, munch, munch. Ah, lick, lick, lick. Chew, chew, chew. Just loving it.
Every time we do buyout, there's a lot of horses in these pens, and we have to have a tractor team come in and scrape them down and clean them out. So last month, I think like we can probably get one more use out of it. So, and then it poured rain yesterday. So now it's all muddy. But part of the intake process is we have to scrape the pens. We have to have the manure hauled away. We also did cover it with hay that was used up hay. We couldn't like feed horses. We covered it in here just to try to make the use of it go as long as we can, but it definitely has to be scraped now. But the longer we can use it without scraping it, the more money it does save to help rescue more horses. So
because it is expensive.
It is expensive to have tractors come in and scrape it down and haul it all away. So, but it's definitely time.
I gave him this little horse some butte.
Yes, sir.
So he's comfortable.
That horse has a ruptured eye.
This poor horse is a gelding, and he has an incredibly swollen sheath, and he's obviously in a lot of discomfort from it. But Dr. Liddy and Dr. Gina were able to ultrasound him, and he's doing okay otherwise. So he's been given everything, and hopefully he can recover and just be super healthy and be a super happy horse.
She's got nothing. See if I can get her tongue better. I know, Mama. I literally just put my finger where her teeth should be, and she has no teeth, so I just hit gums. I know. Can I see for 1 second? You're such a good girl. Your tongue is so slimy. I'm sorry. I know that was so mean.
Hard to age a horse when there's no teeth to age the horse off of.
Yeah, based on the lack of upper incisors. See how our upper incisors aren't really there? They're all the way smooth. And then the length and angle of the lower incisors. I aged her in her 30s. She could be 32, she could be 39. I'm not really sure. What's hard with these guys too is it's not just the incisors, both upper arcades are recessed into the gums. So not only is she worn to the gums, she's worn past the level of the gums. And you can see her body condition score is extremely low. I would BCS her about a 2.
She has arthritis down there.
Oh yeah. I think this is ring bone, Connie, if you feel right here. So she's got bony abnormalities. She's lame on
Hold
her
off before you put them anywhere.
right front and left hind leg, but it's so heartbreaking because this mare probably worked last week,
Yeah.
despite limping and looking this thin. And she finally probably got to a point where she couldn't do her job, and so they just kicked her into the slaughter pipeline. She also has a very painful ruptured left eye. So there's a bunch of different reasons why an eye might shrink. Rupture is the worst one because it's very acutely painful. The optic nerve basically gets exposed to things it shouldn't. So she would need to have her left eye removed and have a pretty significant surgery. And I don't think it's fair to put her through that. I'm very, very concerned that this mare would be extremely difficult to get her to gain any weight.
And she's
Yeah.
We're going to be taking lunch here real quick. Another trailer is coming today, and we want to make sure that our staff are all fully fed. We don't have pizza donated, as you've seen, but we're going to be taking a break for lunch, and then we're going to be right back at work, intaking and assessing the horses on today's buyout assessment, almost live. We're back from lunch. Come to find out the trailer's not coming today. It's going to be coming tomorrow, so we have 2 more trailers and 30-something horses coming tomorrow. But we're going to keep doing the assessment and intake on the horses that came in this morning, the 16 of them. And we're going to get right to work, and we're going to be super busy for a long time. We had our lunch, and the horses are having their lunch. They look really happy eating their hay and just relaxing and getting ready to be assessed by the veterinarians.
Thank you.
You're limping there, buddy.
Oh my goodness, ma'am. Hi, big girl. This mare has pretty bad lameness. She's lame on this right front foot and both hind legs, but more on the left. She has deep suspensory limb desmitis, which you guys hear us talk about a lot. That unfortunately is a chronic, progressive, incurable condition. What I would love to do, since we have our new ultrasound, is we're gonna image her suspensory apparatus in this leg. You can see deep and superficial tendons pretty well on this mare, so I think we're gonna get a really good image, and maybe we can get some more information about how severe things are and how long it's been going on. It's a really big old scar right here.
Oh, wow.
And we're gonna find out how deep this injury was.
So do you think the back leg, are they separate injuries or is it compensatory?
No, it's hard to say.
Uh-huh.
These older guys that have been worked for so long, it feels like these are separate issues.
Sure.
Yes, perfect. We have more gel, please. Yeah. Do you want me to hold the iPad so you don't have to do two things at one time?
Sure. The orientation of this.
Yes. Skin. And that is scanning down. So you see this tube, that's the tendon sheath. Is it adhered back there?
Looks like it.
Yeah. So deep is gonna be this one, superficial is gonna be this one. You can see both tendon sheaths.
I'm doing the back leg. What are y'all seeing? Anything interesting?
Yeah, she has quite a few adhesions in this tendon sheath. And
So what
like
does
a
an
complete
adhesion mean? Sorry.
disruption.
Okay.
So the tendon should run in a nice smooth area through the tendon sheath, which should look black because it's fluid filled. And right here, that completely stops. So there's no longer a functional sheath. It's just stuck. So the suspensory apparatus is supposed to smoothly move through its sheath, and this one can't move at all in this location. And you can see, like here we have a nice black smooth area, and then here it's just completely stuck. Do you want to look at that, Dr. Gina? Look at that right there. I suspect that a lot of this abnormality is because she's trying to compensate. So she has two painful legs in the back and one painful leg in the front, and this is kind of the only leg that I suspect doesn't hurt her. So she's got abnormal musculoskeletal wear because her legs have been hurting for so long. It's also abnormal.
So just look at this horrible hoof care on this horse. Between everything else, just complete and utter lack of hoof care. And that's just ridiculous. Like, farriers can be hard to find and farriers can be expensive. But if you don't have a farrier and you can't afford a farrier, don't have a horse. It's kind of just common sense.
Got him? Hey. Thank you.
We got 4 bags.
Yeah.
We still got 4, okay.
Coming around.
What do you see?
Redo it.
Yeah. You're gonna retake it. Bone chip.
And this horse is completely missing its left eye. And we're trying to get it in the chute right now. Come on, buddy. You're good. It's like, I ain't going in there. Yay.
Horse?
Yep. So this horse right here is done. We gave it all the vaccines that it needed. We did not give it strangles, however, because it does have nasal discharge on both sides and swollen lymph nodes. It is going to need a eye enucleation, and we're going to try to get that done tomorrow morning. So we're going to go ahead and put him straight onto a trailer, bring him straight down, and put him in the stall in the vet barn.
You should probably clip that.
Cute little horse. Corey is clipping a injury here. Look, maybe a little puncture injury or something. And I'm sure the doctors are gonna
How are we doing on time?
figure out what's going on.
Without diagnostics, their lungs sound bad, and you're like, you gotta have it. Look at it. Oh, that's poor baby.
King horse mare. So Dr. Lydia and I are going to use our new ultrasound system to check out her lungs and her reproductive system because she has significant respiratory noises on auscultation with our stethoscopes. And because she's a 15-year-old mare, Dr. Lydia just wants to make sure she's not pregnant. So I think we're going to start with looking at her lungs first, and then we'll switch probes and do the pre check.
And that's right, we have a brand new, super good quality ultrasound thanks to the extreme generosity of a donor. And it just makes our diagnostics so much easier, so much more accurate. And that way we can get to the bottom of any problems that these horses have and find out what their quality of life is, you know, because it seems like when they come to us through these buyouts, a lot of them, they have a lot of tremendous problems. And the veterinarians are doing everything they can to diagnose and treat disease and determine quality of life. Dr. Gina is working the probe for the ultrasound and looking at her screen, trying to figure out what's going on with the lungs.
That's okay.
Caitlin is the magic of the records, keeping everything straight, keeping all the coggins, the whatever blood needs to be tested. Such a great help for the vets, for sure.
Let's prioritize this horse over this horse.
So Dr. Lydia just said this horse has an old carpal fracture.
I haven't assigned it yet, but here's the latest and next one. Oh.
I was trying to get her to play the video, but she wouldn't sit still.
What do you reckon, Corey?
I didn't check the age. I was checking to see if it had a lip tattoo or not.
Gotcha. I was going to say, that's getting faster.
That black one does have a tattoo.
That's a beautiful image.
21.
21-ish. Cool. Getting some radiographs on this horse. See what's going on up there in the front right knee. This is the age.
Yikes.
Abby, normal.
Here.
And then
And no bueno.
What are you saying, Dr. Gina?
Badness. Very badness. Bad juju. So all of this is not supposed to be there. It's supposed to be nice crisp lines, and there's lots of floppy bits. Lots of growth that shouldn't be there. So let's see if there's any. Yeah, that moth-eaten appearance they were talking about. So osteomyelitis versus some kind of neoplasia.
I'm not a radiologist. On the left side, Dr. Gina was able to do it. So that's an infectious risk to others, but also looks like he's got a lot of gunk that's probably very irritating. Betadine is much less irritating to the mucosa of the eye than other kinds of soap and stuff. So obviously my goal is not to go in the eyeball, but I'm getting these eye crusties off with some betadine. Heart rate's 36. Look at this.
Yeah, it has pus coming out of it.
Yeah, we gotta get that.
Dental rods would be awesome. Based on Galvani's groove, he only looks 20, but based on the angle and wear of the incisors, he looks a lot older.
What would you put him at?
1 second. I know. Well, he doesn't have any upper incisors, but he's got really long lower premolars and molars.
Glidden?
Yeah, he's worn. Both maxillary arcades are worn. Way past gun line. I would say like 23, 24.
Okay.
How old is he? How old does his brand say?
Oh, that's a good thing. We
Yeah, let's check it out. Let's check it out.
VP761.
Another horse coming into the chute and onto the scale. They may have to put a lead rope on the horse and lead it in. Sometimes that's easier.
Bring out photos.
Yeah, we got blood pulled, we got pictures.
You want fishing in the chute? They said something about maybe fishing.
Come on, buddy. Into the chute.
I don't know yet.
Dr. Lydia checking you out.
Yeah, I don't want to do it too many times, but if you watch right here, see this muscle fasciculation? She's got pain on wither palpation, so I'm doing it very gently because I don't want to cause her discomfort. But sometimes swayback horses are great and sound to ride, and sometimes they have a lot of pain associated with losing condition over their back and kind of getting a swayback appearance. This mare also has a grade 3 out of 6 heart murmur. And I think this is just an abscess right here.
She's got pretty much all baby teeth except for one incisor. What do you think, Dr. Lydia?
It is really nice being able to go a little bit slower and more thorough on the horses. We're getting a lot of ultrasounds and x-rays, and each horse is getting a lot of hands-on. I would say most of them are actually seen by both veterinarians. And it is kind of nice not having all the horses come in a single morning, but it certainly is going to spread out the buyout over the week. So there's pros and cons to everything, but this is the way it's working this month. So yeah, here we go. Going to keep helping horses. He's such a cute horse. Look at this pretty little face.
A sequela to cardiac disease or other types of organ disease can be a general ill thrift and loss of body condition.
So Haley Macy doing such a fabulous job getting the filming done today, and be able to see this in not the episode of Horse Shelter Heroes that's being released this Thursday, but next week. So it takes some time to get all this editing together. But yeah, it's absolutely amazing the hard work they do. And Dr. Lydia is palpating this horse, see if there's anything going on with the back, just checking them out all over the place.
You see the pain response is much worse on one side than the other side. So sometimes when it was like really poor saddle fit or like too big of a rider, you can have uneven. Did you guys hear that? You can hear GI sounds from the outside of this horse.
Oh my.
That's how hypermodal we are. Got diarrhea standing on her legs.
S-O-C-K.
So thanks to our new ultrasound machine, we're able to actually see what's inside of this. Palpitation can only tell so much, and you'd never want to lance it if it was a hernia, so the new ultrasound is just being so helpful.
That looks like GI to me. Well, this is, what is that? We don't know. This is whatever is in here. And then down here, see these little boop, boop? Those are loops of GI.
But I mean, if you want to go see and, you know.
So if this were a body wall hernia, we would expect to have gastrointestinal tract like immediately outside, and we can go, here's body wall and here's GI tract right past it. And ingesta makes this kind of black shadowy thing, and that's normal. Did it the wrong way.
Which one?
I don't know if we know.
So this is body wall and then GI tract. This is also body wall and GI tract.
So what are you seeing?
I'm able to confirm that we don't have GI tract like immediately under the skin right here. So we don't ever want to poke GI tract. But it also doesn't look fully fluid filled. So we're going to put a bigger needle in and see if we can get at very least some cells out. We can do some in-house cytology. But what's good news for her is that if this isn't a body wall hernia, it's a lot more fixable. I could totally agree with you though. Like feels fluctuant, but
Yeah,
okay.
could be inspissated pus.
So,
Okay.
ready?
I handed it to her and I was like, I took the cap off.
You saved me.
You feel a lot shorter when you got up beside?
Sorry, knee-jerk reaction.
No, that was perfect.
You look like an old man.
I know, I'm sorry.
Nothing.
No. I don't know that this needle is
Long enough?
long enough. You can see it. See it right there?
Yeah.
And you can see it suctioning right there. You're gonna redirect.
Yes, it is.
See the stricture?
Uh-huh.
You're a good boy. Or girl, actually.
Boy.
Boy.
Okay, all right, so Jordan's got it now.
Yeah, I remembered it. I'm really smart. No, why don't people in Greece wake up before dawn? Before
idea.
sunrise? Because dawn is really tough on Greece.
Big boy. Can I look in your mouth, please, handsome sir?
Any quitting?
If we get custody and some of them are
You have like no incisors.
Whoa!
No teeth.
So some of them, if the
His lower premolars are like 2 inches long, and they're digging into the roof of his mouth on both sides.
Buddy.
Big old one.
Sure
Sedation.
does. Yes.
If I need to get out of the way, and I'll run straight to Jason.
Tiny bit of sedation, and he is gorgeous.
Corey's holding the horse up. And what are you hoping to see in there? Are you doing a dental?
I'm gonna do an exam first and reduce. Well, I'll start by saying if he's not gonna have fixable teeth, we're not gonna do a whole lot with them. So this is an exam first. See how pointy this is? Long and pointy right there. This tooth is like this much higher in the front than the tooth behind it.
Yeah, the front teeth look terrible.
Okay.
Poor guy.
Troy, can you hold the tongue out this side of the mouth? Got it?
Yep.
Okay. Okay, I need the tongue out the other side of the
Okay,
mouth.
let me
please.
switch to the other side.
Okay.
Troy, switch with me. Yeah.
Ooh, that's hot.
All right.
Oh man, this side's even worse. You guys see how rock super sharp that is?
So we're down to the last 2 horses. The big draft horse is getting some emergency dental care. And over here, we're getting some radiographs on this horse. And these 16 horses, they're all been seen by the vet. They've been given what they need to make them comfortable. There's one tomorrow morning that's going to have an emergency eye enucleation. And it's just amazing how well our vet team and all of our staff are working today. We're able to get through all 16 in pretty quick order. And I'm going to go check up with Tawny, see what she thinks today, how it went. And I just want to thank you guys so much for donating to make it possible to save these precious horses. And tomorrow there's going to be a bunch more horses coming. I'm unfortunately probably not going to be able to do the intake live, but thank you guys so much for your support.
We're wrapping up today, and I want to give a huge shout out to the donor who donated the ultrasound. You know who you are. You came here for a visit and you saw firsthand why we needed an ultrasound. So this was the first time we were able to use it during an intake. So how was that?
I mean, I don't even have words for how incredible it was. We always do the best we can with what we have in shelter medicine, but our number one, my mind is blown by the incredible quality of the image that we got.
And this is a handheld. Like when
it's so tiny. It's so tiny. So this is 3 of the 4 probes. Don't let it deceive you. This is a very expensive piece of diagnostic equipment, but It's incredibly user-friendly. The image quality is amazing. Like, it's better than the giant industrial ultrasound that I used when I was at UGA. So
Yeah.
we had at least 4 patients today that we wouldn't have had a solid answer and we would have had to guess. And because we had the ultrasound, we didn't have to guess, which is incredible. It's so much more fair to our patients when we have those. So including a really young horse with a very weird presentation that I haven't seen before.
Yeah, everything, like if you're here at Horse Plus, you see everything.
Yes.
And we might be like, oh, we've seen it all now. And then a horse like comes in today that we're like, I don't know what this is.
Yes. So the ultrasound is just tremendously helpful. And unlike a lot of the equipment we use is kind of good for one thing. The x-ray equipment and the ultrasound do so many jobs. The ultrasound really can kind of only evaluate bones. I'm sorry, the x-ray can only evaluate bones. The ultrasound can evaluate any soft tissue. So gastrointestinal, thoracic, musculoskeletal, all of these body systems we suddenly can image. It's a big learning curve.
And we saw like the heart beating and then like it would stop and not be beating. And then like in the intestines, all the movement within there, like it's incredible. So we're just wrapping up today. We thought today was gonna be our busiest day, but tomorrow actually ends up being our busiest day. So we were able to take it a little bit slower and do the best for each and every horse. And we will be doing a debriefing. So I know you all have a lot of questions about the whole buyout and like, you know, what happens to all the different horses and, you know, what's going on with that horse. You'll want to watch our debrief that will be on YouTube, and that will go over in greater detail. So
one question, what's your next wish list on the veterinarian?
Oh man.
Oh, we have a big presentation wish list. And one of these times we might just have to do a YouTube live and explain it all. But there's a lot on there that is a huge needs. One thing I did find out today is we did have a donor that was going to fund the quarantine expansion project. She's realized that she can't fund the complete project. So she is going to be putting up a matching donation of $50,000. And she's hoping that the rest of you, like she's already put a lot of money into this expansion project. And now she's saying, look, I can do 50 more thousand, but I will do it as a match and ask your donors to help with the quarantine expansion. So we don't want to be freezing this winter. So watch for a fundraiser for the quarantine expansion project. With the buyout program, we are rescuing more horses than we ever have before, intercepting them from slaughter. And we have to have a better intake facility to do this job. So be watching for that fundraiser. And again, thank you so much for all of your support.